Hi, my name is Anna Swift. I am a registered nurse that works here in Towson, Maryland. I'm going to be talking to you today about COVID-19, the pandemic that has been affecting every one of us individually, our communities, our loved ones, our workplaces, the nation, and it's been affecting us worldwide as we know it. And basically how this pandemic and health crisis pertains to the building industry. So the Maryland Building Industry Association has been working hard to keep the building industry open, which means that they are going to start operating and continue to operate under very strict and safety guidelines to keep every employee and employer safe during these times. So today we will be reviewing a number of ways to comply and remain safe during this pandemic and what that will look like for your employees on a day-to-day basis. I just want to say any information that I talk about today will be found on the Maryland Builders Association website, which is marylandbuilders.org/coronavirus. So visit the website for further information and resources. So before we talk about safety on the job site, we're going to discuss a little bit what COVID-19 is. So what is this disease that we're dealing with? It is a respiratory illness that came from the novel coronavirus back in late 2019. So really it's only been here for a few months. It's very new and we're learning about it every day. What we do know is that anybody can get it. So nobody's immune to it, although some people or individuals are at a higher risk for contracting the disease than others. Currently, there's still no specific treatment for it, just supportive measures that we can do for patients that have it. There is still no vaccination or immunization either. The good news is the majority of people who contract the disease are able to recover. However, some people do suffer from life-threatening problems from the disease, and some people do die from it. So the absolute best way to prevent this illness is to avoid it. So avoid being around people who have it and just distancing yourself from others. Signs and symptoms of COVID-19 range from mild to severe. Respiratory symptoms include sore throat, cough, shortness of breath, so feeling like you can't catch your breath. A lot of patients present with fever. Some people get body aches and chill that mimic like the flu type of symptoms. Other people have nausea, vomiting, runny nose, symptoms like that. So as we discussed before, there is a population that's at a higher risk for contracting this disease. And those people include people who are 65 years or older, anybody with some sort of comorbidity, including diabetes, obesity, chronic heart disease, are all at a higher risk. Anybody who's immunocompromised, so on chemotherapy, or have any other autoimmune disease that would make them immunocompromised. And then, of course, people with chronic lung disease. So, people who have asthma or other lung diseases are also at a higher risk for having severe outcomes for this disease. So knowledge is power. Knowing the signs and symptoms, knowing how to prevent it and avoid contact with others is very important. Okay, we all have a responsibility. Every individual in the community has a responsibility to do our best to help stop this disease. We are first going to go through the employer's responsibilities to help prevent the spread of this disease, to protect their employees, and the preventative measures that they can take to help do so. So when discussing this, it's important to remember that every construction project and environment is different. So what might be feasible for one type of work environment may not be for another, but there are generalized safety measures that we can all take to help fight this pandemic. So the first most important thing would be to develop a COVID-19 exposure action plan. And these guidelines are based on the Center for Disease Control and Prevention and the Occupational Safety and Health Administration guidelines. So those websites have really good information about what should be part of your exposure action plan. All managers and supervisors need to be familiar with this plan in order to answer questions and implement the plan correctly. So the other important thing is managers and supervisors of job sites are going to be looked upon as leaders during these times and should set a good example for all of their employees, and encourage all of these safe behaviors of every employee that they have. Another safety measure that should be taken is that all staff meetings, if possible, should be done by phone or video conference and not in person. If it has to be done in person, remain physical distance of 6 feet apart if feasible. Don't share, personal belongings, and try to keep your space away from people. Access to the job site and the work trailers should really only be for employees. There should be no visitors or extra personnel on the job sites to prevent less exposure between people. If any visitors have to come for whatever reason, those people aren't typically on the job site. Normally, they should be screened for any signs and symptoms for COVID-19. Employees should be encouraging their employees to stagger breaks and lunches if that's practical, and reduce the size of any group on the job site to 10 or less. Due to the nature of the work, you might not have running water. However, every employee is responsible for producing hand sanitizer for everybody, all the individuals on the job site to use, and or wipes for their hands throughout the day. The employer should also produce and have PPE, which is protective equipment, to any employee that's assigned to cleaning or disinfecting tasks, and just PPE for anybody who's on the job. So everybody should be wearing gloves on the job. The type of glove that is worn should be appropriate for whatever task that they're doing. Eye protection should also be provided to all employees and worn at all times on the job site. If it's practical, every employee should use the same truck or equipment every day. It shouldn't be switching in between employees. Just try to keep it with the same person that's operating the same machinery every day or every shift. If anybody on the job site is experiencing any symptoms, the employer should ask them to leave immediately. Employees also have a responsibility. So everybody on the job site that's working there is a part of helping to prevent the spread of this disease. So first and foremost, stick to the basics. Hand washing is key. Distancing is key. Not touching your face is key. So those 3 things are your top things that are going to help prevent the disease. So good hand hygiene includes running water, warm running water, and soap. Washing your hands for a good 20 seconds, if not more. If you don't have running water, you can use hand sanitizer that has 60% alcohol or higher. Maintaining social distance, so staying away from people 6 feet, like we've all have heard and talked about in the past few months. So staying your distance away from coworkers. If you sneeze or if you cough into your sleeve, not into your hands. Do not touch your face if possible. Try to keep your hands away from your eyes and your nose and your face. As the employee, you are responsible to know and be familiar with the exposure action plan and follow all the elements of the plan. If you have any issues or concerns, questions, contact your employer. They should be able to educate you on that. More than ever, when you're on the site, disinfecting the job sites is very important. So cleaning and disinfecting frequently the tools and equipment that's being used on a regular basis is very important. So wiping them down, making sure that they're clean is going to be part of your responsibility. Cleaning shared spaces such as places where you eat lunch, trailers, break rooms, or bathrooms is also very important. Other things that you may not think about, just shared surfaces in general, so door handles, machinery controls like the buttons, even if you share a pen, something as simple as that should be cleaned on a regular basis. Try your best to avoid sharing tools with coworkers if you can. And the other big thing is if you think that you are sick or you're having any sort of symptom, just stay home and contact your employer. It's better to stay away and to figure out what's going on with your own health instead of coming into work and exposing others. People should not return to work until the criteria to come back to work is met. So the isolation period for which is going on with your signs and symptoms. If you are diagnosed positive with COVID, you will be self-quarantining from work, and you are able to come back to work after at least 7 days have passed from your first positive test and you have no other symptoms. Again, just check with your employee, call them, let them know what's going on with you, and stay home. It's not worth risking coming into work if you think that you may be sick. Lastly, we're going to discuss how to keep you safe and healthy and your loved ones safe and healthy. So my best advice would be use your best judgment. Try to stay home as much as possible. When you are at work and on the job site, follow all of those guidelines for safe contact. And then just when you're home, make sure you get adequate sleep, drink lots of water, healthy diet, things like that will help your immune system be the best it can to fight off any sort of germs, especially COVID, during these times. So at home, what you can do to help make it a little bit safer for your family is do the same thing you're doing at work. So clean the frequently touched surfaces and daily objects, like countertops, light switches, handles, things like that. If somebody in your house becomes symptomatic or you yourself feel like you're getting sick, what I would say is just try to quarantine yourself to one space and designate one bathroom in the house for that sick person. So use a separate room and a separate bathroom for whoever may be sick. The reality is this is an unprecedented time. We're learning about this disease every day. We have new information about it. So the best thing that we can do is try to keep ourselves safe, try to keep the loved ones we are safe, continue to do the good work you're doing, and take care of yourselves. So thank you for watching the MBIA's video on job safety and COVID-19. Please follow the guidelines and share this safety video with any of your colleagues or anybody that you're working with in the industry. Also, visit the website for more resources and information. That is marylandbuilders.org/coronavirus.